I was lucky to find your Twitter account because I'm following a lot of doctors, and I'm interested in keto, low carb, high protein way of eating. So I found your Twitter account and I find it very interesting, to be honest, because I'm following a lot of doctors, but none of them is a cardiologist. So your opinions were different to come. Like, I didn't expect this opinion to come from a cardiologist. That's why it was very interesting to me. And then one day, I've been following Dr. Kamberi for ages, and then I watched your live session with him, and it was very interesting. So I wanted to have you on my channel to share this knowledge with the Arabic speaking audience, because like this kind of information, it's very hard to reach this kind of information if you don't speak English. So this interview will be translated into Arabic for my audience. We can start by you introducing yourself to my audience.
Sure thing. So my name is Dr. Philip Ovadia, and I am a heart surgeon here in the United States. I have been a practicing heart surgeon now for approximately 20 years. And for much of that time, I was getting progressively unhealthy myself. I had gotten to a point about 7 years ago now that I was morbidly obese and pre-diabetic. And I realized that I was going to end up on my own operating table, so to speak. And the advice that I had been giving my patients, the advice that I had been taught to give my patients, and that I had been following myself was failing me. And over, I saw it failing the patients as well. So I started seeking out some different sources of information. And I ultimately came across carbohydrate restriction as a method to treat obesity and diabetes. And I tried it for myself, and it worked. And I started trying it with some friends and family, and I saw it work some more. And I became brave enough to try it with some patients, and I have seen great success with that. So, I am now on a mission to help people not to need heart surgery, to teach them how not to get sick. I think here in the United States, certainly, and I think this is probably the case worldwide, our healthcare system is too focused on taking care of sick people, and it doesn't put enough focus on how people can avoid getting sick in the first place.
Yes. So let me get this straight. You were like following the food pyramid, where like all your food is based on grains, bread, pasta, and stuff like this, and like minimal fat. And then you developed, or you become overweight, and you developed diabetes or pre-diabetes. Then you started restricting your carbohydrates, and now you're recommending it to your patients, your cardiovascular patients. Whenever I like recommend a low carb ketogenic way of eating, I usually get the same question over and over again. What about cholesterol? Everybody's freaked out about cholesterol, and to be honest, it sometimes, a lot of times, rises when we raise dietary fat and animal protein in our diets. I've seen, like, I'm not sure if are you familiar with the research of Dave Fieldman? Yeah,
yes, very much.
He has a name for the keto lab test, which is like the lipid triad, where usually when people are on a ketogenic, low carb, high protein, high fat diet, their LDL goes up, and their HDL goes up, and their triglycerides goes down. And like, speaking for my clients and for most people, everybody gets freaked out. They're like, yes, this diet is helping me lose weight and help me, like, because everything else is wonderful. It's even unimaginable. Like, blood sugar is way better than ever. Hemoglobin A1C, everything's good except for the total cholesterol and the LDL. So the patient starts to freak out, and their doctor starts to freak out. And usually a lot of people stop this kind of diet just because of their cholesterol, or maybe their prescribed medication. So what do you think of this case? Like, should we be concerned about the high cholesterol on a ketogenic diet?
Yeah, so I know that cholesterol is more complicated than it gets made out to be. The mainstream narrative around cholesterol is that it is the primary cause of heart disease, elevated LDL cholesterol specifically, so-called bad cholesterol, and that it needs to be lowered in all situations. And there is a lot of data that, contradicts that. For instance, many of the patients that I operate on that develop advanced heart disease and end up needing heart surgery do not have elevated LDL cholesterol levels. Some of those patients, because they're being treated with medications to lower their LDL cholesterol, some of those patients just naturally have lower LDL cholesterol levels, and yet they still end up on my operating table for surgery. Furthermore, there are a lot of patients walking around with very elevated LDL cholesterol levels, and they do not develop heart disease. And obviously, in the context of a low carbohydrate diet, we are seeing this more and more commonly. So my contention is that LDL cholesterol by itself is not actually a very good predictor of heart disease. It became the preferred marker for heart disease risk only when we developed medications to lower the LDL cholesterol. If you go back in the scientific literature from before these medications were around, the 1960s, the 1970s, the 1980s, there is a lot of focus on things like insulin resistance as a marker for heart disease risk. And in all of the studies that compare them head to head, insulin resistance or poor metabolic health, depending on how you look at it, is a much greater predictor of heart disease risk than simply having an elevated LDL cholesterol. So that's one thing that I talk to my patients about. The other thing that's important to note is not everyone that does a low carbohydrate diet has their LDL cholesterol level go up. Dave Feldman, certainly has highlighted the lipid triad, as you said, or the lean mass hyperresponder phenotype. And I am fortunate to interact with Dave on a very, somewhat frequent basis. I see him at meetings and we discuss all this. But the reality is that there are a lot of patients who don't get that response, or if they do get their response, it's a temporary phenomena. While they're losing a lot of weight, their LDL goes high, and then when their weight stabilizes, it tends to come back down again. So in the end, I think cholesterol is only part of the story, and it's hard to imagine a scenario where you're doing something that's improving almost every measure of health, and people feel better and they lose weight and they get off their medications, their diabetes gets better, their high blood pressure goes away. And yet this one blood marker moves in a direction that we think is dangerous. But it's really hard to, for me to construct a scenario where you do something that improves everything in your body, except it's harming your heart or one particular organ. It just doesn't make sense that our bodies would work that way. So, when I look at the totality of the evidence, I think in the context of good metabolic health, LDL cholesterol is probably a marker that we shouldn't really be paying all that much attention to. And overall, in the heart disease risk, I would rather people do something that improves their insulin resistance and reverses their metabolic syndrome than worry about their LDL cholesterol, which is a lesser marker of heart disease risk.
Yes. I'm actually curious to know, do you ever prescribe medications to lower cholesterol? Or do you ever recommend cholesterol medication?
Yes, I think there are some scenarios where it makes sense. And the scenario where that makes most sense to me is in someone who is not metabolically healthy, and they're not willing to make changes to improve their metabolic health. If you're in that scenario, then lowering your cholesterol seems to have a little bit of a benefit. It's not a huge benefit. And again, we have to have caution in that the amount of benefit that's been attributed to lowering your LDL cholesterol with medications is not nearly as much as it's made out to be. But if there is some benefit, especially if you've already had a heart attack or some other cardiac event, you have established heart disease, and you just don't want to make the changes to get yourself metabolically healthy, then it probably makes sense to take a statin medication. But I would much rather people improve their metabolic health than just take a medication to try and lower their cholesterol, because over and over, that approach does not end up working.
So basically, medication is a replacement for a lifestyle change, for dietary change and exercise.
Yeah, and again, I think the dietary and the lifestyle change should be the first line of treatment. Unfortunately, that's not how our healthcare system works. And all too often, what I see is people just get prescribed the medication, and their doctors don't even have the conversation that diet and lifestyle is an option and can benefit them. And that, I think, is the biggest failing of the medical system. Because if you give the patient the choice and you give the patient the information on both, and they just say, I don't want to make the changes, I'll take the medication, well, okay, that's on the patient, and they've made their decision. But if you give the patient the medication and you don't even tell them that this is an option, then I think that is a failure of the medical system. When I talk to people, when I explain these options to them, and I say, listen, you can take a medication for the rest of your life. If we're talking about something like type 2 diabetes, we know that the amount of medication you're going to need is going to increase over time. We know that there's still a chance that you're going to get, complications from the disease, or you can just change the way you eat. Most people say, I'll change the way I eat. I don't want to be on medication my whole life, and I don't want to, end up going blind or getting an amputation because of my diabetes. So when given the option, most patients do want to and do end up choosing the diet and the lifestyle. It's just that our medical system is not focused on giving people that option, and we don't share that information as much as we should. And when you do try and share this information, like you said, then this fear-mongering comes into place where, the diets that have been shown to be very beneficial for people with metabolic syndrome, carbohydrate restriction, are vilified because of this one marker that may or may not actually be a relevant marker.
I'm not sure if that's true or not. That's an assumption I have. Is that the maximum normal range we have is 200, 220? Has it always been like this? Has it always been the maximum normal cholesterol 200?
No. So, when you go back through the studies on whether it's total cholesterol or LDL cholesterol, there has been a lowering over time of what is considered an acceptable limit. And again, understand why that is. So this hypothesis was put forward really starting around the 1960s, that, cholesterol was the primary cause of heart disease. Blood cholesterol levels were predictive of heart disease risk, and that if we lower cholesterol, whether through dietary interventions or through medications, that we would lower the incidence of heart disease. And as this was tried, the results were disappointing. So, what was then said was, well, we must need to lower cholesterol lower. And you see this repeating over and over. Statin medications come out, and again, the impact on the overall incidence of heart disease was pretty disappointing. And, heart disease remains the number one killer worldwide. And so the, pharmaceutical industry, the healthcare system keeps pushing this narrative that the problem must be that we are not lowering cholesterol enough. And so we need to keep lowering it even lower. And then we'll get we'll get rid of heart disease. We now have newer medications, things like PCSK9 inhibitors that can lower people's cholesterols to exceedingly low levels. People end up with LDL cholesterol levels under 20 to 30 milligrams per deciliter, very, very low levels. And yet we still see these people developing heart disease. So it's really, just the system is now so far, down this pathway that they can't see that the original hypothesis that lowering LDL cholesterol, is the primary way we should be preventing heart disease was wrong. And they just, the system can't go back. And that's why I try and empower people. I try and encourage people to take control of their health. And, just because the system says this is what you should be doing doesn't mean it's the right thing for you. You hopefully can find a doctor to work with who is open about this and understands this. But ultimately, the decision is yours to take a medication or to not take a medication. And you need to be asking your doctor these questions. What is the benefit of me taking this medication? What is the risk of me taking the medication? And what is the benefit and the risk of me not taking the medication, of me doing other things like changing my diet and lifestyle?
Yeah, at the end of the day, it's everybody's choice. Like, it's my choice whether to listen to the old paradigm or to the new paradigm. But actually, like, we have seen the results of the old paradigm over and over again, and it's been the same even in totally different cultures and totally different parts of the world. I cannot even explain it by genetics. You can't even explain it by anything else other than diet, because like everybody now is following the same diet. What you call the standard American diet, we're following the standard American diet. Like it's the same everywhere.
Exactly. And you see that pattern as it spreads to different populations. You see the same diseases exploding, the diabetes and the heart disease and the obesity. And so the pattern, is very well established. And you're correct. Genetics can't explain it. Human genetics have not changed in the past 100 to 150 years to the degree that we see this change in disease incidence. So it cannot be genetics. Yes, there are a small role of genetics in all of this, but primarily it is the food we eat. It is the habits that we have, our lifestyle, that is causing this severe rise in heart disease and obesity that we've seen over the past 100 to 150 years. And the flip side is that, in the past 50 years that we've had this narrative around a low-fat diet and, the standard American diet, as you call it, the food pyramid, obesity has worsened, diabetes has worsened, heart disease really hasn't gotten better. There was a period where it started to get better between about 1980, before statin medications were introduced, lasting to about 2000. And that's probably attributable to the decrease in smoking. And then it has leveled off, and it's actually started getting worse again the last 5 years. We see an upward trend in the incidence of heart disease and the number of deaths it causes. So if these medications were the answer, if lowering cholesterol was the answer in general, because we know people's cholesterol levels today are much lower than they were 50 and 100 years ago. If that was the answer to heart disease, we should be seeing much less heart disease, and we are not. So that leads me to question, the underlying hypothesis that cholesterol is the primary cause of heart disease.
Yeah, I think that's very powerful, especially hearing it from a cardiologist. Because if now we agreed upon like cholesterol cannot be the main lab test we can rely on for predicting heart disease, what do you think is the best lab test that I can check for myself if someone wants to check their predictability of heart disease, cardiovascular health? Is it like triglycerides? Is it hemoglobin A1C? Is it insulin?
Yeah, so ultimately, insulin resistance is really what we're trying to get at. And that is probably the best blood marker for heart disease. So this is best measured with something called the Kraft test, which is not a common lab test. It's very hard to get, that you actually give people a solution of sugar, glucose, and then you measure their sugar and their insulin blood levels for a couple of hours afterwards. But that test is very hard to get. It's not very commonly done. A fasting insulin level can be used to calculate what's called a HOMA-IR score, a measure of insulin resistance. So fasting insulin is probably, the one test that I recommend as the best one. If you can't get your insulin level checked, then a surrogate marker is looking at your triglycerides and your HDL cholesterol and calculating the ratio. And you want that ratio to be less than 2, and that's in the US units, milligrams per deciliter. And then divide your triglycerides by your HDL cholesterol. And if that is less than 2, it's a decent, pretty that you're, not insulin resistant. So that's ultimately what we're trying to get at in terms of blood markers. There are a lot of other, good blood markers. You can get a lipid, what's called a NMR panel, where you break down the size of your lipid particles. That is also an excellent, a better marker for heart disease risk. And then finally, what I talk to people about is, the blood markers are only allowing us to sort of try and predict your risk. If you really want to know if you have heart disease or not, we should look at the heart and we should do a scan. It's called the coronary artery calcium scan. It's a type of CAT scan that people do not need to get intravenous dye or medication for. The scan takes about 5 minutes. It's pretty readily available, certainly here in the United States and even worldwide. You usually can find places to do this for you, and it will actually show you whether you have plaque, calcified plaque developing in the arteries of your heart. So that is a test that, I think is very important to get. And it actually shows us what we're trying to figure out. Do you have heart disease or not, as opposed to trying to guess based off these blood markers.
Yes. So if someone has been following the old paradigm and eating grains all the time, and now they're convinced that this is not the right way of eating because they have seen by results, and they're starting to gain weight, they're starting to get even pre-diabetic or whatever. What kind of diet, or what kind of, how can they change their way of eating to prevent them from getting heart disease or to prevent diabetes or whatever? What kind of changes they have, everybody should start making. If we're constructing a new paradigm, instead of the old pyramid, what would you recommend to the average person who didn't yet get any heart disease?
Yeah, so I think the best evidence that we have is, restriction of carbohydrates to some degree, and eliminating processed food are probably the two, best changes to start with. And one sort of accomplishes the other. When you eliminate processed food, these are foods that come in a package. These are foods that have been, the nutrients have been stripped out of them. And they are often high in carbohydrates, especially refined carbohydrates. Those are the two changes in the diet that I think have shown the best evidence for avoiding metabolic syndrome. And we know, again, that metabolic syndrome is the biggest risk factor for heart disease. So that's the approach that I would start with. Now, there are many different ways to accomplish that. You can do that on a plant-based vegan diet. You can do that on a carnivore diet. You can do that with things like keto and Mediterranean and paleo and all of these things in between. But ultimately, the goal, if you want to give yourself the lowest chance of developing heart disease, the best chance of avoiding heart disease, is to, control your blood sugar and insulin levels and avoid insulin resistance. And, for me, the best way to do that is with carbohydrate restriction and eating whole, real food. Low carb becomes a relative term. And depending on your level of fitness and, your metabolic health, I don't think everyone needs to eliminate all carbohydrates completely, but it becomes a relative term. I think intermittent fasting is a great tool, like you said, that can help people. Most people find it difficult to fast when they are still primarily dependent on glucose and carbohydrates for energy. It's much easier when you're fat adapted and, have a ketogenic metabolism to fast. So that's another advantage of low carb and ketogenic type diets. Ultimately, I tell people, listen, there isn't one right diet for everyone. I don't have the Dr. Ovadia diet plan that's going to fix everyone's problems. Everyone needs to find the right dietary strategy that works for them, and the markers that we should be using to determine if that dietary strategy is working for you are the markers of metabolic health that we have been talking about: insulin resistance, triglycerides, HDL cholesterol, your blood glucose level, your blood pressure, and your waist circumference. And if those measures are all getting better, then I say whatever whichever dietary strategy you're employing, that's the one that you should stick with. But ultimately, you have to find something that is sustainable for you and is going to improve those 5 metrics. And as I said, for the vast majority of people, that's going to be something on the low carbohydrate spectrum, as I would say, and it's going to be centered on eating whole, real food. Processed food has never been shown to benefit anyone's health. Every study, there are all of the diet wars out there that we see: the vegans, the carnivores, the keto people, the Mediterranean people, all of this. But when you look at it, the commonality, the common factor for diets that are ultimately, successful in achieving metabolic health is elimination of processed food. And again, processed food does not benefit anyone's health. It really only benefits the bottom line of the food companies.
Yeah, so any diet that will get you off the processed junk food will benefit your health, and it will improve all these lab markers. Yes, I'm actually curious to know your opinion about vegetable oils.
I do not think people should be consuming vegetable oils. Again, they are a highly processed form of fat. The amount of omega-6 fatty acids that they deliver is way out of proportion to anything we have consumed, for the vast majority of our existence as human beings. And why did they become popular? They become popular because they lower people's LDL cholesterol level. I don't deny that fact. If you eat vegetable and seed oils instead of natural animal fats, saturated fats, your LDL cholesterol level will go down. But I don't think that that's making you healthier. I don't think that's helping your heart. And on the other side, these oils are highly inflammatory, and the ratio of omega-6 that we end up getting in our diets compared to omega-3 is way out of proportion with our ancestral diets and what our bodies evolved for. And so I do not recommend the consumption of vegetable and seed oils.
Yes. I have a video about vegetable oils on my YouTube channel, and I was saying that it's totally man-made and it's processed and it's negatively affecting our health. And there has to be a correlation between humans have started to have vegetable oils instead of butter since 50, 60 years. There has to be some correlation between this and obesity, diabetes, and all the modern disease. But I got so many comments from different cardiologists that they recommend this kind of oils for their patients, again, because it lowers their LDL cholesterol. And it doesn't matter if something is processed or man-made, as long as it will benefit your health. So I'm glad that you said that even if it lowers your LDL cholesterol, that's not the point.
Yeah, and again, just look at the evidence all around us. These these vegetable and seed oils have been a increasing part of our diets. The predominant fat consumed, here in the United States, we have good data showing that it has become the predominant source of fat in the diet. And what do we see? We see obesity going up, we see diabetes going up, we see heart disease continuing to be the leading cause of death. So the macro evidence is that they just don't work. And we have the interventional trials, the scientific interventional trials that have looked at this show that, for instance, the Minnesota coronary experiment, where they substituted, processed vegetable and seed oils for saturated fat in the diet, and it lowered the LDL cholesterol of the group of patients who were getting the vegetable and seed oil, but it did not lower overall mortality. In fact, it seemed to increase it. There may have been, there was a slight decrease attributed basically in non-fatal heart attacks. And then overall mortality was worse in the group that was consuming these vegetable and seed oils. So the only data point that supports the use of vegetable and seed oils, again, is that it lowers LDL cholesterol, but it does not end up leading to better overall health and longer lifespan.
Yeah, so we should get back to eating butter. We have in the Arab world, we eat butter, we eat ghee all the time. But now it's becoming also kind of a trend where everybody's using sunflower oil and soybean oil and stuff like this. Also because they're very cheap. They're way cheaper than butter.
Exactly. And, that, as I said, is the main benefit of vegetable and seed oils, is to the profit margin of the food companies. Again, when you think about the big concepts, would it make more sense to continue eating the foods that we have eaten as humans for millions of years? Or do we think that, these foods that were created in the past 100 and 150 years are going to be ultimately better for our health? And, if I had to bet on that, I would say, let's stick with what we were doing for millions of years, because it seemed to actually be working pretty well until we started messing with it.
Yeah, because we call it the modern disease. And they didn't start until we started inventing food, until we started frying stuff and stuff like this. Because I'm a low carber and I'm kind of biased, but still, even if it's refined processed fats like vegetable oils, I would never recommend it, even if in a ketogenic plan.
Yeah, ultimately, as I said, when you look at the evidence, it's clear that the more processed food we eat, the sicker we become. Now, whether it's the vegetable and seed oils or the refined carbohydrates, those are the two main ingredients in all processed food. And it's hard to really say for sure whether it's one or the other or the combination of the both. But the bottom line is neither of these things are essential to our diet. We know that carbohydrates are not essential to the human diet. And certainly vegetable and seed oils are not essential to the human diet. So, why not just cut them both out? And, whichever one of it ultimately is what's harming us, we will have eliminated. And, to my eye, what I see is that people who are metabolically healthy can tolerate some amount of carbohydrate, and that should be less processed carbohydrate, things like fruits and, I don't have much trouble with in someone who is metabolically healthy. But, I don't see any evidence that we can really tolerate any level of vegetable and seed oils. And again, they're clearly, to my eye and to many others, not beneficial to our health, and they're not essential. So why would we go about consuming them?
Yeah, I totally agree. I want to dive into exercise, at least I want to know what kind of exercise would you recommend to someone for their cardiovascular health? Would you recommend cardiovascular exercise or resistance training?
Yeah, so my primary message around exercise and overall health, and specifically cardiovascular health, is that, building and maintaining muscle as we get older is one of the best predictors we have of both how long you will live and your quality of life, for however long you live. So I always prioritize resistance exercise, building and maintaining muscle. If you have the time, and if it's a activity that you find enjoyable, cardio exercise can be a good additive to that. But building and maintaining muscle should be your priority. Muscle is the most metabolically active tissue. The more muscle you have, the better your chances are that you're going to be metabolically healthy. So that is where I put my priority when it comes to exercise.
Many triathletes and many cyclists, like this kind of athletes, the aerobic training athletes, when they see someone training at the gym and building muscle mass and stuff like this, they're like, this is good for your looks. It will make you grow muscles and you look better, but it's not good for your heart. I've heard it times and times again. So you're saying resistance training is even better to prevent cardiovascular health than aerobic cardiovascular workout?
Yes, and again, I think not only for your heart but your overall health. It's very very good data that we have that the better that you are able to maintain your muscle mass as you get older. That is a very strong predictor of how long you will live and your quality of life. Does that mean we all need to become professional bodybuilders? No, of course it doesn't. And for most people, doing resistance exercise is really only going to, maintain muscle, maybe build a little bit of muscle if you work very hard at it. It's pretty difficult to, get to the level of a professional bodybuilder.
Every advice you just gave, it's basically taking care of your metabolic health, and it will take care of your heart. You don't need to do anything specifically for that.
Yeah, exactly. Again, it makes sense that what is going to improve, one thing in our bodies is going to improve our bodies overall. And, and again, we have the data that shows this. When you look around heart disease risk, the biggest risk factor consistently in the studies that measure it is metabolic health, insulin resistance. And so if you focus on that and you move that in the right direction, I think everything else is going to move in the direction it should with it.
And building muscle mass is going to help with improving insulin resistance, with improving overall metabolic health. Question: do we actually know the reason why cholesterol and LDL rise on a ketogenic diet? Do we know the scientific reason why whenever we base our food on fats, our cholesterol goes up? For the people, I know, as you said, I'm pretty sure it's not for everyone, but it's fairly common.
The honest answer is we don't know why some people see this rise in LDL cholesterol when they go on a low carbohydrate diet. I think the hypothesis that Dave Feldman and others have put forward, that it has to do with energy trafficking, makes a lot of sense. If we are functioning under a ketogenic metabolism and we're increasing our dependence on fatty acids for energy, it makes sense that those are going to be, carried in the bloodstream more, and we're going to need more of these LDL particles to shuttle all of this, all of these fatty acids around. So that makes sense to me. Dave and his team and many others are doing great work to try and figure that out more and to try and, get the scientific studies that we need to help prove that hypothesis. But the honest answer is, we don't know that for sure. And what I still come back to is, is your metabolic health overall good? And if so, we probably don't need to be concerned necessarily. We don't need to be concerned about LDL cholesterol. And ultimately, you should be working with your physicians to go beyond the LDL cholesterol number. Whether it's looking at advanced lipid particles, it's looking at insulin levels, it's looking at these other markers of metabolic health that we talked about, or ultimately looking at things like a coronary artery calcium scan that can tell you, are you developing heart disease or not? That's what I hope people are able to do, and hopefully people can find good physicians to work with that understand that.
I think many people who got high cholesterol and ketogenic low carb diet will feel very relieved after this, because I understand the worry. If you have been told that something is going to kill you your entire life, you're justified to freak out if you suddenly see it rising up. So I totally understand this. So I think this will be like comforting to a lot of people who get this issue, because it's very common. Also, like, I like how you wrapped up all the metabolic health advice. And like, just if you're going to like follow simple advice, just eliminate processed junk and do it whatever way you want. Like if you want to go vegan, want to go carnivore. I also always say any diet that gets you away from junk food will improve your health. And any diet that will convince you that you can have it sometimes or whatever, it will like someday, maybe you'll someday pay for it. So I like the correlation. I like the correlation between metabolic health and cardiovascular health, and it's actually very, very related. To sum up what we said, we should care more about our metabolic health and our lab tests, like regarding insulin resistance and home IR and whatever test or CRAP test, whatever test we do for our insulin and metabolic health, more than like cholesterol and LDL. And like, it shouldn't be like our major concern for our health.
Yeah, I think that's a very good summary. Again, it just look at the big picture, focus on your metabolic health, and things that are going to improve your metabolic health are going to improve your health overall.
Yeah. I'm very thankful for you that you took the time for this. This is going to help a lot of people, because again, like if you're not speaking English, it's very hard to reach this kind of information. So this will be translated into Arabic. I also have a question. If we have any way, I follow you on Twitter, so I'll add your Twitter account in my description. Is there any way we can reach you? Like, do you have an Instagram account or a YouTube or whatever?
Yeah, so I am on Instagram and YouTube. If you search for Ovadia Heart Health, you'll find me there. And then if you go to my website, ifixhearts.com, that actually will take you to a quiz that will allow you to assess your metabolic health. And then it leads to all my other information as well.
I like this quiz. I'll take it. I'll take it. Thank you, Dr. Philip, so much. I will inform you once the interview is translated and uploaded, and I will send you the link. And I cannot thank you enough for taking the time to do this. It will help so many people.
Yeah,
like we're in the other side of the world, and we're left out.
Yeah, no, keep up the great work. I think there are, just like in the United States, worldwide, there seems to be an increasing focus on this. Efforts like, I don't know if you've come across the Nutrition Network, which is Dr. Noakes's organization, Tim Noakes, that is kind of spreading the metabolic health message worldwide. There are a few other cardiologists out there that talk about this. Dr. Aseem Malhotra in the UK is a big one. I think the message is spreading slowly. There's still a lot of work to do, but I think the more that we can work with each other, support each other, the better we're going to end up. So thank you for all the great work you're doing.